Well, hello, everyone. Today, we're going to talk about RSV disease and vaccines. My name is Dr. Tina Tan. I'm a professor of pediatrics at the Feinberg School of Medicine of Northwestern University and a pediatric infectious diseases physician at Ann and Robert H. Lurie Children's Hospital of Chicago. So these are my disclosures. So I think this is really important to talk about right now because we know that RSV is one of the most common causes of acute respiratory tract infection in persons of all ages. And RSV typically circulates in the fall, winter, and spring. So here in the US, it's usually between October and the end of March. And the thing to remember is that RSV causes disease in persons of all ages. And each year in the United States, RSV leads to approximately 2.1 million outpatient non-hospitalization visits among children under 5 years of age, with the vast majority of these cases occurring in full-term healthy infants under 6 months of age, and somewhere between 900,000 and 1.4 million outpatient visits among adults 65 years of age and older. Now, all this disease leads to up to 80,000 hospitalizations among children younger than 5 years of age. But if you look at the adult population, this can lead up to 160,000 hospitalization among adults 65 years of age and older. And this can result in up to 10,000 deaths a year in this age group. And in the pediatric age group, we can see about 300 deaths a year in children under 5 years of age. The risk factors for severe RSV illness are shown here. They include premature birth, very young infants, especially those under 6 months of age, American Indian and Alaskan Native infants and children, crowded living conditions, persons with any type of chronic lung or chronic heart disease, persons of any age with a weakened immune system for any reason, neuromuscular disorders, including those that cause difficulty swallowing or clearing mucus secretions, older adults 65 years of age and older, and just also remember adults living in long-term care facilities or in nursing homes. So you can see that there are a wide variety of risk factors for individuals developing severe RSV illness. And this basically shows you the number of RSV surges that we've had in the US between September of 2021 and September of 2023. And you can see during that time period, we've had 3 separate surges, which is a little bit abnormal in a 1.5 year span of time to have that many surges. You can see the last surge occurred between August of 2022 and March of 2023. And now we're moving into RSV season. So it won't be unexpected in the next couple of months to start to see an increase in the number of RSV cases occurring. And if we look at what occurred during the last RSV surge, we know that the last RSV surge was an unusually large surge that caused a lot of hospitalizations. And the RSV hospitalization rates at the peak of the last surge were about 5 per 100,000 versus 1.5 per 100,000 pre-pandemic. So you can see that that is a 4-time increase in the number of individuals that required hospitalization. There were 3 to 4 times the number of infants and children that were being hospitalized compared to prior years. And the other thing which was unusual about the last RSV surge was that there was an increased number of older children requiring hospitalization. And if you look at the adult population, you can see that there were up to 2 times the number of adults being hospitalized compared to prior years. So what is the outlook for this year's RSV season? Well, if you look at Australian data, this basically gives us an indication of what to expect for this RSV season. This looks at data from Australia from this RSV season. And what you can see is that there were an increased number of cases that occurred in 2023 compared to 2022. But the other thing that was noted is that there were some Australian states and territories that were seeing almost 10 times the number of RSV cases compared to 2022. So based upon this data, we can expect that this is going to be a fairly severe RSV season for persons of all ages. And I think the thing that makes this RSV season a little bit different is that now we have ways of protecting individuals against RSV disease and against hospitalization and complications. And the first of these are RSV vaccines that are recommended by the ACIP of the CDC, of which there are two. There is an RSV pre-F3 vaccine, which is an adjuvanted RSV vaccine, recombinant prefusion F protein vaccine that's given as a single dose and is recommended only for use in older adults at this point in time. The other RSV vaccine that is available is an RSV pre-F vaccine that is a recombinant prefusion F protein vaccine that is not adjuvanted, given as a single dose. And this vaccine is recommended for use in both older adults and in pregnant women. And if you look at the vaccine efficacy of these vaccines, if we look at the GSK RSV vaccine first, in phase 3 double-blinded placebo-controlled clinical trials that were performed in 17 countries and enrolled almost 25,000 participants 60 years of age and older, the vaccine efficacy against RSV-associated lower respiratory tract disease for season 1 was 82.6%, and for season 2 was 56.1%. And if you combine the efficacies for seasons 1 and 2, it's about a 74.5% efficacy. If we look at the Pfizer vaccine in phase 3 double-blinded placebo-controlled clinical trials performed in 7 different countries that enrolled almost 37,000 participants, all adults 60 years of age and older, the vaccine efficacy against RSV-associated lower respiratory tract disease was almost 89% for season 1 and 78.6% for season 2, so that the combined season 1 and 2 efficacies for this vaccine was almost 85%. So you can see that these vaccines in older adults actually provide very high efficacy rates for protection for 2 different RSV seasons. And the recommendation that the ACIP has for the use of these vaccines in older adults is that they recommend that adults 60 years of age and older receive a single dose of RSV vaccine using shared clinical decision-making between the patient and their healthcare provider. The vaccine dose should be administered prior to the start of RSV season, and individuals can continue to receive vaccination throughout the RSV season if they're eligible and they're unvaccinated. And the other thing that's important to remember is that you can co-administer this RSV vaccine with all other recommended adult vaccines, and this is encouraged and is acceptable. So just remember that flu vaccine and COVID vaccine are also recommended during this time period and should be given and can be given at the same time as an individual receiving the RSV vaccine. Now, if we look at maternal vaccination recommendation, the vaccine of the 2 RSV vaccines that are available, it's the Pfizer vaccine that is approved for use as a maternal vaccine. And the recommendation is that the maternal vaccine be administered to pregnant women between 32 and 36 weeks gestation in the OBGYN's practice. It's given as a single dose, and the vaccine efficacy based on phase 3 clinical trials showed an almost 82% effectiveness against severe medically attended lower respiratory tract illness due to RSV in infants born to moms that had received the vaccine. And this is an efficacy from birth through the first 90 days of life. And there was a 57% effectiveness against severe medically attended lower respiratory tract illness due to RSV in the mothers that had received the vaccine through the first 90 days of the infant's life. And then there was a almost 69% vaccine efficacy through the first 6 months of life in infants and a 51.3% vaccine efficacy through the first 6 months of life in the mothers. So you can see by vaccinating the moms, you are able to protect these young infants against severe RSV disease. And if you look at the safety of these RSV vaccines, there were no safety concerns that were detected in the infants or the mothers who had received the RSV vaccine, and there was no difference in reactogenicity and adverse events that occurred between the placebo and the vaccine recipients. And in older adults, there was a slightly higher rate of local reactions, meaning pain, redness, and swelling at the injection site in the vaccine recipients versus the placebo recipients. But there were similar rates of systemic events and other adverse events in the vaccine versus the placebo recipients. So you can see that these vaccines are actually quite safe to use in pregnant women as well as in older adults. Now, the other way that we can prevent RSV disease in young infants is by the use of nirsevimab, which is a long-acting monoclonal antibody for the prevention of RSV lower respiratory tract disease in infants. And the recommendation is that all infants age under 8 months of age that are born during or entering their first RSV season are recommended to receive 1 dose of nirsevimab, and the dose is going to differ depending upon the weight of the baby. Studies that showed that there was a 79% efficacy in preventing medically attended RSV, an 81% efficacy in preventing hospitalization for RSV-associated lower respiratory tract infection, and a 90% efficacy in preventing ICU admission for RSV-associated lower respiratory tract infection. So you can see that this monoclonal antibody is very, very effective in protecting infants from being hospitalized and from the complications that may occur with RSV. This monoclonal antibody is also recommended for children ages 8 to 19 months of age who are at increased risk for severe RSV disease and who are entering their second RSV season. And they're recommended to receive 1 dose of nirsevimab at 200 milligrams administered as 200 milligram injections given at the same time at different injection sites. And shown here are the children that fall into this increased risk of severe RSV disease group. And just keep in mind that American Indian and Alaskan Native children are considered at increased risk for severe RSV disease and can be given a second dose of nirsevimab. And these recommendations are supported by both the CDC as well as the American Academy of Pediatrics. Now, providers should target the administration of nirsevimab during the birth hospitalization. If the baby does not get it during the birth hospitalization, then shortly after discharge from the hospital and by 1 week of age in the outpatient setting. And it can be given during a scheduled well child visit before the start of the RSV season. And note that infants with prolonged birth hospitalizations should receive nirsevimab shortly before or promptly after hospital discharge. And a single dose of nirsevimab can be administered to age-eligible infants and children who have not yet received a dose at any time during the RSV season. And again, simultaneous administration of nirsevimab, which age-appropriate vaccinations is recommended, as nirsevimab is not expected to interfere at all with immune response to other vaccines. And the question that has come up, for which now we have an answer, is if the mom received RSV vaccine, how do you use nirsevimab in the infant? And what the CDC recommends is that nirsevimab be given to infants younger than 8 months of age that are born during or entering their first RSV season if their mother did not receive RSV vaccine, if the mother's RSV vaccination status is unknown, or if the infant is born less than 14 days after the mother's vaccination. So these are situations in which the infant should be receiving nirsevimab, even if the mom had received a dose of RSV vaccine, but the infant is born less than 14 days after the mother's vaccination, or the mother's vaccination status is not known. So I think the key points to take away from this is that we know that RSV can cause serious illness in infants, children, and adults, with those under 2 years of age and those 65 years of age and older being at the highest risk for developing severe RSV disease. We know that vaccination is the best preventative method of protecting individuals from developing severe RSV, lower respiratory tract disease, complications, hospitalizations, and deaths. And now that RSV vaccines are available and monoclonal antibody is available, these are the best methods of providing protection to infants, children, and adults against RSV disease. And we should take advantage of the availability of these tools and protect our patients against getting RSV disease. But also remember that you can give these vaccines at the same time as the other recommended vaccines, so that those individuals that are eligible should also be receiving flu and COVID vaccines, as well as other routinely recommended vaccines. And thank you so much for listening to this presentation, and I will stop here.